Here is your question. All right, so if you have read and understood, considering it critical care scenario, please tell me how would you manage this patient?
Ma'am, this patient is under sepsis. So I would, my management will be prioritized towards sepsis, ma'am. I'll start her with IV fluids, airway.
First, you have to
and then
convince me what makes you think that patient has sepsis.
she's having BP is less than, systolic is less than 90. So she's in shock. Next is her temperature is high, and her output, urinary output, is deteriorating. So
Kindly tell me what are the differential diagnoses that you'll consider.
my first
for this
diagnosis will
patient?
be a diverticulitis, ma'am,
Okay.
followed by left ureteric colic and sigmoid volvulus
Okay.
and gastroenteritis
All right. Yes.
and
that is possible.
pelvic tumor, ma'am. My
Right.
last
So
diagnosis will be pelvic
now
tumor.
you think that she is in shock. Please define the shock.
Yes, ma'am. Shock. Shock is defined as failure of the circulatory system to. There is failure in the circulatory system, so there will be hypoperfusion, which results in organ failure, ma'am.
Okay. That results in the vitals like blood pressure is low, temperature is high, and urine output is also less. All right. Now, considering that, we have established, all right, that has affected arterial blood gases as well and blood cells as well. Okay. So now please tell me what are the steps what are the measurements you'll take in order to take care of this patient?
Ma'am, first I would secure her breathing. I'll give her oxygen through mask. Second, I'll resuscitate with IV fluids, probably with crystalloids.
Why
Then
probably? Why probably? Why you're not
no,
sure?
I'm sure, ma'am. I will definitely resuscitate with IV fluids. And if she's picking her, if her blood pressure is picking up, I will continue with IV fluids. If not, if there is any requirement, I'll start her with inotropes, ma'am.
Okay. So there are different
Then I'll give
types
her.
of, yes, shock. What type of shock is she suffering from?
She is having a septic shock, ma'am.
Okay. So what is the criteria in order for you to determine that it's septic shock?
She's having signs of sepsis, ma'am.
Yes, which is
So
in association with low blood pressure, hypotension.
low blood pressure, yes, ma'am.
And
So it is defined as sepsis with shock, which results in hypotension and hypoperfusion, which leads to organ dysfunction.
yes.
And there will be increase in lactic acid and
Very good.
renal
And
failure. Yes, ma'am.
yes,
Renal failure.
renal failure and altered Glasgow Coma scale.
Yes, ma'am, and altered Glasgow Coma scale. Yes,
Yes, this is something we should appreciate. That's why it says disoriented, because Glasgow Coma scale is less than 14.
less than.
All right.
Yes, ma'am.
Okay. So you said you will be giving inotropes as well. Right.
Yes,
What
ma'am.
renal support would you give to the patient?
Ma'am?
What renal support would you give to the patient? Because arterial blood gas is showing metabolic acidosis. And
Yes,
there
ma'am.
is partial compensation. That means respiratory support is not there. So what
Yes, ma'am.
respiratory support or renal support would you
Oh, yes, ma'am.
advise for
So
this?
respiratory support, I would, depending upon the patient, ma'am, whether I'll go with invasive or non-invasive. So probably I'll go with NIV, that is non-invasive. So it consider of BiPAP and CPAP, continuous positive pressure, and BiPAP, ma'am. If the patient is not responding, probably I'll go for an invasive method. That is, I'll intubate the patient, ma'am.
And
The
next,
renal,
yes,
for the renal part, my target would be 0.5 ml per kg per hour output. So that is my target. If
yes,
for that I will initially I'll give a fluid challenge,
yes.
and if the patient is not recovering, I'll go with furosemide and dopamine support, ma'am. And depending upon it, then if the patient is not recovering, I'll go for a renal replacement therapy. So renal replacement therapy is nothing but hemodialysis, peritoneal dialysis, and continuous renal replacement, ma'am.
Right. Meanwhile, what investigation would you ask for and
I
why?
will I will I will go for a blood culture. I'll culture, ma'am. I'll culture the patient. I'll go for blood
And
culture, urine culture.
anything else?
I'll check for her lactate and total count, WBC count, ma'am.
Yes, but any other investigation you'll do in order to rule out the condition or to confirm the condition? CT scan.
CT scan, yes, ma'am.
Yes, why?
Since she's having left iliac fossa pain, so I am suspecting diverticulitis. So I will go to rule out any abscess or perforation. I will go for CT scan, ma'am.
What are the disadvantages of doing CT scan in this situation? Please name two.
Disadvantages of CT scan: patient is in shock, ma'am. So we cannot shift her. So she needs to be under inotrope support. So that is one disadvantage. Second disadvantage is
Just think
we
this is
cannot give
not
her
a,
contrast, ma'am.
sorry, this is not a disadvantage. It's your headache to mobilize the patient. If CT scan is needed, it's needed. All
Yes,
right.
ma'am.
One, you
Contrast,
said
we cannot give her contrast, ma'am,
you cannot give her the
because of
contrast because of the renal. Okay.
yes, ma'am.
Could there be any other disadvantage
Uh,
because of the wound?
breathing,
High
ma'am.
morbidity. Patient,
Yes,
look,
ma'am.
age, high morbidity. So be
Oh, yes,
considering
ma'am.
that you'll not. Okay. Please tell me, how would you take care of the nutritional status of the patient meanwhile?
Ma'am, if the patient is conscious, I will
Not
encourage
conscious.
her to go with enteral oral feeds, ma'am. If the
Yes.
patient is not conscious, not able to tolerate normal diet, I will go for total parental nutrition, ma'am.
All right. Okay. Right. You said you'll send the lab for blood cultures. What exactly would you ask for? Which
Blood
cultures?
culture, ma'am.
Yes. Which cultures would you ask for? Yes.
I didn't get the question, ma'am. Sorry, ma'am.
You said you'll send the blood for the cultures. Which
Yes, ma'am. For
yes,
organism.
which organism you'll ask for, or what would you particularly say?
Okay, ma'am. So I will ask to start my specific antibiotic. So I'll ask for blood culture, ma'am. So probably I'll expecting gram negative coverage, ma'am. Organisms
Okay.
like
That
E.
is
coli,
one thing.
Klebsiella.
All right. How would you take care of the metabolic acidosis of the patient?
Metabolic acidosis, I will
How would you correct that?
sodium by giving a sodium bicarbonate, ma'am.
Okay. Solvent. Right. Ideally, what type of antibiotics can we recommend the patient?
Broad spectrum antibiotic without nephrotoxic, ma'am.
All right. Okay. All right. How would you take care of right, excess base or excess lactate in the blood?
Yes, ma'am.
Yes. How would you take care of that?
Ma'am, probably lactate acidosis occurs because of increased dehydration, ma'am. I will give her fluid, ma'am.
Yes. And you'll shift the patient to HDU. high
Yes, ma'am.
dependency unit, because here she has come in accident and emergency. She will not be able to be managed here. You
Yes, ma'am.
just can give the first aid, then she has to be moved.
In
to
a
the-
high dependency unit.
So
Yes, ma'am.
that actually, I wanted you to tell me the whole procedure. How would you
Okay, ma'am.
take care of this? All right, good. Thank you.
Thank you, ma'am.
Thank you. Right. Very good.